How is a colostomy created in Hartmann's procedure? Imagine needing to remove a diseased part of your colon and still having a way to pass waste. That's where Hartmann's procedure comes in. It's a surgical operation often used in emergencies for complicated diverticulitis or other severe colon issues. The goal is to remove the problematic segment and create a new pathway for stool to exit the body. So how exactly is the colostomy made during this procedure? Let's walk through it step by step. First, the surgeon begins by removing the diseased part of the sigmoid colon, which is the lower part of the large intestine. Once that segment is taken out, the surgeon needs to divert the remaining healthy colon to prevent waste from passing through the affected area. To do this, they choose a spot on the left lower side of the abdomen, usually in the left iliac fossa, to create the opening for the stoma. Next, the surgeon makes a circular or oval cut through the skin and the tissue just beneath it at the marked site. This opening, called a trephine, exposes the underlying layers without removing too much tissue. The next step involves incising the anterior rectus sheath, which is the tough fibrous covering of the abdominal muscles, in a vertical line. To keep the stoma away from the midline, a small lateral incision is made as well. Then, the rectus abdominis muscle fibers are carefully split along their natural direction. Afterward, the surgeon makes a vertical cut in the posterior rectus sheath and the peritoneum, which is the lining of the abdominal cavity. This creates a passage through the abdominal wall. The end of the now removed descending colon is gently pushed through this opening from inside the abdomen, rather than pulling it, to avoid twisting or tension. Once the colon is outside the body, the surgeon checks to ensure it's healthy and not twisted. The next step is to mature the colon as an end colostomy. The bowel edges are sutured to the skin edges, with the colon protruding about 0.5 centimeter to 1 centimeter above the skin surface. This slight protrusion helps prevent stool from irritating the surrounding skin. The fecal contents then exit through this new opening, bypassing the rectum and anus, which are closed off during the operation. This process effectively diverts stool away from the diseased or inflamed part of the colon, allowing it to heal. The rectal stump remains inside but is closed off, often producing mucus that may be passed per rectum. Hartmann's procedure is typically performed in emergency situations, especially when there is perforation or severe infection. Depending on the patient's recovery and future plans, the colostomy may be temporary or permanent. In summary, creating a colostomy in Hartmann's procedure involves surgically bringing the end of the divided colon through an opening in the left lower abdomen, securing it as a stoma to allow waste to exit the body safely. Always remember, this is a complex surgical process best performed by experienced surgeons, and anyone considering or needing this procedure should consult their healthcare team for personalized advice.